Everyone, welcome back. I'm Dr. Ushna Naveed. I am from Derm online platform. Today we are about to discuss the histopathology of Pityriasis Rubra Pilaris. It's a great disorder which has a key microscopic feature which has helped to understand the characteristic pattern of the histology of the PRP. By the end of the session, you will be able to confidently recognize the histological hallmark of PRP and apply them into the clinical practice and examination setting. So let's begin. If you see at the slide, having a look at the slide, you will what you are really appreciating in this slide. So this is a picture from the DermNet. DermNet is a very good source of all the dermatological topics and also the histological pictures and the clinical pictures also. So just having a look at the picture, what you really understand, always look the picture at the low microscopic view. So at low microscopic view, you should be able to identify what's wrong in the dermis and what's wrong in the epidermis. So where is the basic pathology lies? This is the most important question. Then you have to go in a stepwise approach. Like if you just have a look at this picture, maybe you are not able to recognize anything as a beginner, you are not able to see any change, but don't worry, we will discuss the topic one by one, and by the end of the lecture you will be able to recognize the PRP so well. So if we compare the things together, like this is a normal skin, absolutely normal, you are able to see the glands, blood vessels in the dermis. This is all the connective tissue and the blood vessels are in the dermis, and in epidermis there is a beautiful layer. There is no hyperkeratosis, no increased thickness of the epidermis. This is absolutely normal thing. Just in a magnifying view, these are the layers of epidermis. The topmost layer is the stratum corneum. Then we have lucidum, spinosum, and the basal layer, which is a very, you can say, attached to the basement membrane, the basal layer, the last layer of the epidermis. So these are the basic layers of the epidermis. You should have an idea about it. This is a normal epidermis. But if you compare this slide with this one, immediately your eyes catches a difference that this epidermis and this epidermis are not similar. Here you have a corneum layer, just a small thin one, but here the corneal layer is so enlarged, so thickened, and so the term we used in histology is known as hyperkeratosis. Hyperkeratosis means the thickness of the stratum corneum has been increased. By definition, if you called it as hyperkeratosis, we divide the hyperkeratosis into two categories. So hyperkeratosis is just the thickness of the stratum corneum, and it has two categories. One is known as orthokeratosis and one is known as parakeratosis. The difference between the ortho and the para is only the nuclei. If your cells are retaining the nuclei, this is known as parakeratosis, and if the cells are devoid of the nuclei, they are known as orthokeratosis. This is very important because in some histological slides you have ortho predominantly, some have para predominantly, and some have alternating pattern of orthokeratosis and parakeratosis. So this is parakeratosis. You can see these are small nuclei which are present on the cells. The blue dots, these are all nuclei. So all the stratum corneum cells, which are basically your keratinocytes, they are loaded with the nuclei, which is not a normal phenomena in your histology. This here you can see no nuclei. You are not able to see any nuclei. This is a normal phenomena of the stratum corneum. But here you can clearly appreciate the nuclei. This is a parakeratosis. But in PRP, what happens before rushing towards the PRP slide, you have to understand the basic concept of hyperkeratosis, acanthosis, and you have learned para and ortho as well. So hyperkeratosis is the thickness of the stratum corneum, the topmost layer of the epidermis, and the acanthosis is the thickness of the stratum spinosum. Okay, so it's beneath the corneum. So spinosum, here you can see this thickened layer, this blue layer, all the thickened layer, this is your acanthosis. Due to this, your reti ridges, this is known as reti ridges, it appears elongated, it is somewhat enlarged, somehow we call it as acanthosis depending upon regular or irregular, and this is hyperkeratosis. So just a difference between the two layers. This is a slide of PRP. So if you put things together, here you can see nuclei. These blue portions are your nuclei. So definitively this is your stratum corneum and this is a nuclei portion, so known as parakeratosis. But in between the parakeratosis, you can see there is no nuclei. This is clear, smooth stratum corneum. So obviously this is known as orthokeratosis. So if you put the things together, orthokeratosis parakeratosis, orthokeratosis, then parakeratosis. This is forming a pattern. So this pattern is known as checkerboard appearance. Checkerboard appearance. The checkerboard is basically this one, the board of the chess. So you have some orthokeratosis, you have some parakeratosis because retaining of nuclei it will appear darker. Then again orthokeratosis, then again parakeratosis. So your epidermis is giving the appearance of the checkerboard pattern. This is the very first catching point of your PRP, hallmark of PRP. Then you can see in the slide that this is a hair follicle. This is a follicle. Obviously, we are not able to hear the shaft, but this is a follicle. We can just have a look at the epidermis. We are able to appreciate the follicle. So immediately after stratum corneum, eye is catching the importance of the follicular follicle that is present in the PRP slide. So this is known as hair follicle and it is plugged with the some material. So this is known as follicular plugging. Another very important feature of your PRP slide. Then the third feature, you can see all the this stratum spinosum has been elongated. Okay, your rete ridges has been elongated, becoming so prominent, so pronounced. So this is known as basically acanthosis. So difference between the PRP acanthosis and the difference between the psoriasis acanthosis. In the psoriasis you have very regular club shaped rete ridges which is known as regular acanthosis, but in PRP you can see some rete ridges are long, some are short, some are very long, some are short. So this is known as irregular acanthosis. So this is again very important point. So if we go just point by point or stepwise approach from top to bottom, first of all you have to see from low power, then you have to go to medium power and high power of microscopic view. Do not jump to the high power view. You will miss a lot of findings in the slide. So first of all, in the low power, you have to see whether the epidermis is thickened or not. So this is a low power view. You can easily appreciate that my epidermis is so thickened and this was my normal epidermis. So just having a look, you are able to appreciate at the low power epidermis is having some change or not. Then after this, you are just making the differences that acanthosis, if you are able to appreciate whether this is regular, which is psoriasiform hyperplasia, or this is irregular. Irregular is basically not having equal rete ridges, just like in psoriasis. Then you see at the stratum corneum, you have orthokeratosis plus parakeratosis, checkerboard appearance, very typical. This one finding is very typical for your PRP. Then you have after that checkerboard appearance, you are able to see the follicular plugging, a beautiful follicle that opening can be seen that is plugged with the keratin. Basically, this is known as follicular plugging. Around the follicle, the very important feature of the PRP, another important eye-catching feature is the shoulder parakeratosis. Now, what is shoulder parakeratosis? You can easily identify that this is a slide of PRP basically. You have orthokeratosis, you have parakeratosis, orthokeratosis, parakeratosis, checkerboard pattern. Here is the follicle, and this is a shoulder of the follicle, just like a shoulder of the human being. So this is the shoulder basically. So shoulder, this is your follicle and this is your shoulder. Just at the shoulder of your hair follicle, you have a lot of parakeratotic burden. Okay, this bundle is known as shoulder parakeratosis. So what are the points of PRP we have gathered so far? Checkerboard appearance due to ortho and parakeratosis, then follicular plugging, very important feature, shoulder parakeratosis, and one more important thing, your eye is catching another important point, that you are able to see a granules in the granular layer, which was not there in the psoriasis. If you go through the psoriasis video I had made yesterday, so go through that video and compare the slide of psoriasis with the PRP, then you will be able to see that in psoriasis there is loss of the granular layer or mild very thin granular layer is there, but in PRP you have very thick focal or confluent hypergranulosis. Okay, this is a feature of your PRP again. Then you have perivascular lymphocytic infiltrate. These are the vessels and these are small lymphocytic infiltrates. Follicular plugging is very important. Shoulder parakeratosis is very important. And your acanthosis is going to be irregular acanthosis. So these are all the features of PRP. And PRP is very important for your exam. So if you have found this video beneficial, so subscribe to the channel. And if you want any other topic to be covered, just comment in the comment section. I have a platform that is Derm Online. We basically covered whole of the rooks and the exam preparation specifically for the PG trainees that are appearing in the FCPS exam or any other board exam. So you can contact me if you want to join for the preparation. That is a paid session, 4 months course in which we complete whole of the rooks, including the MCQs, including the recall drills. So that will be beneficial for your exam. Thank you so much.